computer. Hello, everybody. This is another episode of Artificial Intelligence and Cybersurgery. I believe this is our 26th episode. This is the podcast/webcast of the journal Artificial Intelligence Surgery, the first journal dedicated exclusively to artificial intelligence and surgery. I'm very happy to have here our guest, and I'll let my co-host, Dr. Vincent Grasso, introduce her to everybody.
Sure. Thanks, Andrew. Hi, Dr. Vincent Grasso. I'm the Director for Social Media and Strategy at our journal. And as Andrew said, we are the only surgical journal dedicated to all things AI. It's a great pleasure and privilege having Dr. Francesca Ratti on today. She's at the hospital San Rafael, correct, Francesca, in Milano, and you head up hepatobiliary surgery there. Very excited to learn more about what you're doing and how AI you see fits into your practice, perhaps moving down the road or even now. But thank you for taking the time out and joining. Welcome.
Well, thanks a lot for the introduction. It's a great pleasure for me to be here today. As you said, I'm Francesca Ratti, and I'm an hepatobiliary surgeon here at San Raffaele Hospital in Milano. We are an hepatobiliary surgery division led by Professor Luca Aldrighetti, and our activity is fully dedicated to the treatment of liver tumors. We are dedicated only to resective liver surgery. We do not have a transplant unit here. And we currently perform an average of 350 liver resections per year. Currently, our ratio between minimal invasive and open activity is almost 70% minimal invasive. One half of the minimal invasive activity is by laparoscopic approach and the other half by robotic approach. And then we have 30% of activity of open liver surgery. Our activity is dedicated, as I was telling you before, to the treatment of liver tumors with a main focus on primary liver tumors and especially cholangiocarcinoma, both intrahepatic and perihilar forms. This is our main focus.
That's a lot. You're one of the premier centers in Europe, and certainly in the world, as you know. Long silence.
Yeah. Yes, I think that our numbers are currently quite high. And what we try to do is, even though we have a very huge volume of activity, to try to provide patients with a tailored patient treatment within definite protocols of treatment for each kind of disease. Which is our main, endpoint in the daily practice.
So Francesca, I'm curious, are you originally from Milano? Did you do your training at San Raffaele? Can you tell us a little bit about your background? You're fantastic about talking about San Raffaele, but I'd love to know more about you also.
Okay. So I'm originally from the northern part of Italy, not really Milano, but from Brianza, Monza, which is a city close to Milan.
I know it, of course.
Yes, it is quite famous because of the car races.
Yes.
Right. Sure.
The Formula One, of course. Yeah.
Yes.
And there's also a beautiful palace out there also, no?
Yes.
Yeah.
Yes. There's a beautiful palace which is in the same place of the car race circuit.
Ah, nice.
Yeah.
Oh, beautiful.
I did my university studies here at San Raffaele Hospital, and I took my degree with a thesis about liver failure. And then I did the residency in general surgery, even here in San Raffaele Hospital, with a final thesis about enhanced recovery after surgery in liver surgery.
Nice.
So this is my background.
You are a Milano doc.
Yeah.
Yes.
I am.
Did you ever spend any time in any other centers around the world aside from visiting at conferences and things like that?
Unfortunately not, because at some point I decided to go abroad, but then I got pregnant, so I decided that it was not the right time to go abroad.
Yes.
And then I stayed here, and you know that things in life can change suddenly, and that's why at the end of things I didn't did any period abroad.
But well, you know, you're at San Rafael, so we have an expression in America: the only place you could have gone was down. You were already at the top, so it's
well, you can be right, but it is always important. I think that you can agree on this to have an overview of what other people is doing, of how other people work. So I think that a period abroad could always be a good choice for people who want to get a good experience in general in surgery, not specifically in hepatobiliary surgery. So I would definitely recommend to young people to go abroad as far as possible, to see as many centers as possible, because you manage always to get something from other people, both in negative and in positive, I would say.
Yes, of course.
But it is always important to see how other people work, because you can get something from anyone.
And where did you learn English? Why do you speak so well?
Well, no, I don't think I speak so well, but anyway.
Particularly for an Italian, you do speak you speak very well.
Okay. Thank you. At simply
at school?
Yeah.
Yeah. Okay. And when did you start? You use the robot, I presume.
Yeah.
And when did you start to use the robot? And I presume it's Da Vinci.
Yes, it is Da Vinci. We started our robotic activity in 2021 with one session per week until the end of 2021. And then currently we have the availability of 2 sessions or 3 sessions per week.
Nice.
So currently we have a series of 250 liver resections performed by a robotic approach. And we do not currently have a specific indication for the robotic platform, except for the idea that we generally reserve to robotic approach more complex cases, because our feeling is that the robot may reduce the risk of conversion.
I think it's a good philosophy also. It justifies the increased expenses also. I think it's a very good philosophy. Now, Massimo Falconi, he's in the pancreatic division. He's not in your division at all. You're totally separate?
Yes, we are totally separate. Yeah.
So you do exclusively hepatobiliary, as you said? Yeah.
Yes, it is quite an exception even for centers in Italy, but we are totally separated. We have an hepatobiliary surgery unit and a pancreatic surgery unit. So we are completely different units. Yeah.
Now, you mentioned the angel behind you. What is that beautiful building behind you?
So this is the university, the San Raffaele University, and this is the main building of the university. You see that there is the angel, and behind the angel there is the helix. You see helix.
The helix, yeah.
Yeah, which is the representation of the helix of the DNA. And it goes down in the building and more or less until the floor. And it is the place where the university is located, both in terms of the dean and the main offices, and even rooms for students.
So I always like to add in some interesting things on our podcast. So permit me to ask, isn't there a famous, very beautiful room that was built at San Raffaele for a particular person? I heard perhaps with gold ornaments, or maybe this is just a rumor. That is not what I'm looking at behind. That is something else, or do you not even know what I'm talking about?
No, I mean, I think this is the legend.
Okay. I will I will pursue further offline then. Okay. Very, very
Yes.
good. Now,
We don't have, I'm sorry, but we don't have rooms made of gold. So if anyone is searching for them, I'm sorry, but we don't have.
it's not there. Okay, okay. Now you also are interested, I believe, in augmented reality, or are you more interested in indocyanine dye, or are you interested in both?
I'm interested in both.
So
Yeah.
I'm going to ask you right off the front, because I love to ask this question of people before you tell us, your specific interest. Do you consider indocyanine fluorescent dye a form of augmented reality? Do you consider it biophotonics? Do you consider them separate? Do you consider them as a complement? How do you consider them?
I would say that they are both systems to improve intraoperative, or let's say perioperative navigation in liver surgery. As you know, the topic of navigation in liver surgery is a hot topic, both in order to good preoperative planning for the patient and to do a good liver resection, because if you don't understand exactly what is what in liver surgery, in general in surgery, okay, we agree on that, but specifically in liver surgery, it is a problem. So any kind of instrument which helps the correct identification of structures, both preoperatively and intraoperative, improves the safety of the patient and hence the postoperative outcomes, both in terms of perioperative outcomes and in terms of oncological outcomes. Because if you manage to perform, for instance, a more conservative surgery on a specific patient, thanks to 3D reconstruction and to indocyanine green staining during surgery, and you manage to perform a more conservative surgery, maybe this patient will benefit in the future of a redo surgery. So this is something which can really improve the outcome of our patients. So the topic of navigation is, I mean, it's not only fancy, but it is really important for the oncological and perioperative outcome of our patient. And I would say that ICG and augmented reality are complementary. They are both instruments that we can use even separately or combined in order to improve our capability to understand the liver anatomy and to correctly perform our procedure. So
beautiful. I totally agree. What is your definition of augmented reality? And how is that definition different? I think it'd be interesting for our listeners to understand kind of the differences.
Okay, so augmented reality is something that we add to reality, meaning that you put on what you see another image, which in some way improves your capability to recognize structures, but you still see what is around you. This is augmented reality, in my opinion. So you still see what is around you, but you have a 3D reconstruction of the CT scan, of the MRI, which improves your capability to understand which structures can be spared, which structures need to be sacrificed during the surgery. So it is very good for preoperative planning and even for education and training of surgeons in training.
Right, so it's an image superimposed on what you actually see.
Yeah.
And so explain, if you would, fluorescent dye, how that works a little bit. Just how you would explain it to a patient.
Yeah. Fluorescent dye is something that we use in order to, well, in hepatobiliary surgery, we have different ways to use the dye, because the green dye helps you to identify specific structures or parts of the liver. You can use it to stain liver tumors, you can use it to stain biliary ducts, or more importantly, you can use it to perform a good anatomical resection. In this case, which is in my opinion the most important use that we have of ICG in liver surgery, is to use it injected intravenously, while when you have already isolated and closed portobiliary pedicles going into the part of the liver that is going to be resected, in order to obtain a negative staining of the part of the liver to be resected. This is, I think, the most important and common use of ICG in liver surgery, but even other uses can be useful. What is important is to know which is the overall scenario of possibilities of ICG in order to use it in the most correct way in that specific patient, because it is not so obvious that you can use it in all the ways. So you have to decide, okay, in this specific case, I think that ICG can be useful for me for tumor staining rather than for anatomical guide, rather than for biliary anatomy. So you have to plan it.
Now, as you know, one of the limitations of augmented reality on soft tissue, like the liver that's elastic and flexible, is that we have a very hard time keeping the image on the liver as we manipulate it, which is why, as you also know, fluorescent dye is much more utilized, I think, in today. And do you think that we will ever overcome in our career the problem of augmented reality and the problem of elasticity, or should our efforts be focused on indocyanine, or should we combine augmented reality interpreting, in computer vision with indocyanine to maybe get, the best form of navigation?
Well, I don't think that we have to think about them as mutually exclusive. Sorry, I just.
Yeah, go ahead.
One second.
Yeah, put yourself on pause, and Vincent and I will talk. No problem. Okay. Poor Dr. Ratti is on call.
He's on call, huh?
Yeah. So we'll let it. It's actually fine because we've done about 20 minutes. I just want to talk. I'm not sure if you're aware, but she's doing a special issue with Professor Takeaki Ishizawa, who's an indocyanine expert in Japan. He did a fellowship where I did a fellowship with Brice Gaillet in Paris, and we actually wrote a paper today. He was not today. We wrote a paper together. He was the first author. I was the second author that went into Annals of Surgery, and he was telling me how he really was the pioneer in indocyanine dye, and I had no idea. Dr. Ratti, you're back. We know you're busy, so we'll let you tell us what's going on. You have a few more minutes?
Yes, absolutely.
Okay, perfect.
No problem.
All right, well, we just have a few more minutes. I just wanted to let you finish your thought on indocyanine and augmented reality, and then that is going to go perfectly into the paper, the special issue that you're doing with Takeshi Ishizawa. So
I was saying that we don't have to think about augmented reality and indocyanine green as mutually exclusive, but as complementary. I don't know if in the future augmented reality will overcome the issue of modification of the liver during surgery. The most trivial way to overcome this problem is to have dynamic reconstruction during surgery, which need probably the presence of let's say, advanced operating rooms with CT scans integrated, which is something that is far to be really implemented into the clinical practice.
Right.
But I know that some groups all over the world are working on this topic in order to solve this problem, even thanks to softwares of artificial intelligence that will predict the modification of the liver during surgery, so that the reconstruction will be able to be modified and will be dynamic and will show the surgeon how liver moves and changes during manipulations, mobilization, and opening of the liver transaction plane.
Right. No, I mean, I agree. I think that indocyanine and is really, personally, I consider it a form of augmented reality. You know, I think as the two will just fuse, you know, as you're saying. So do you want to tell us a little bit about your special issue? I mean, I already talked about it while you were offline. You want to, why don't you just
Yes.
give us a minute or two on your thoughts on what you would like to accomplish in your special edition?
Yes, as I was telling you before, the topic of navigation in liver surgery is absolutely amazing and important. And currently, the topic that liver surgeons are working on are augmented reality on one side and indocyanine green on the other side. So our aim with this special issue would be to provide a good overview of the state of the heart in these topics, and about how the situation will evolve in the next years, because it is likely that we will live a widespread evolution of these approaches in really a short period of time. So probably liver surgeons will be able to use these instruments in the daily life. So everyone should be aware of these evolutions and of these possibilities in the next future. So this is our idea.
So Vincent, what do you see as some of the technological limitations that we have to overcome to get to this dream of navigation during liver surgery?
Well, as Dr. Ratti mentioned, being able to dynamically generate anatomical and geospatial correct points when there's motion and movement of the organ is a challenge, right? So that's an interesting research area. We had done a lot of work early on in being able to navigate through space with needles and whatnot, using tactical audio as a feedback. I think there's some research going on with the use of ultrasound. So an ultrasonic beam penetrating the right upper quadrant into the liver provides a trajectory that can be analyzed. And as things move along those planes, you can compare it to a prior reference point, like an angiogram study. So these are all computationally intense things. They're very hard to generate in the operating room unless you've got the computational power and the software that's going to perform that. So this is a software engineering challenge. It's a lot of disciplines that have to be smashed together, which makes it so exciting, right? This is so exciting. We'd love to have you back on if we could, to continue the discussion about, you know, maybe this technical point, you know, surgical navigation. Where is it going? How can we enhance it with AI? Very, very exciting topic, and applaud your efforts.
Yeah, one of the ways that they're trying to overcome this is the STAR robot, where they do an autonomous anastomosis. Is they actually first inject the edges of the cut intestine with fluorescent dye on both of the lumens, and then the computer can see the dye and it can do an anastomosis. So I wonder if you know, maybe one of the next steps would be to inject the liver with fluorescent dye in certain parts that will able to you know, make change in real time that is actually useful for the surgeon. But we obviously we'll have to see. Dr. Ratti, you're on call. It's been about 30 minutes. I could talk to you for a very long time, but I know we have to let you go. Do you have any more comments you'd like to leave with us before you go?
No, I just want to to stress that it was really a pleasure for me to be involved in this talk with you, and I would stay here for hours as well to talk about artificial intelligence and navigation systems, because I think that this is really the future, and brainstorming is really important in this area, because as you said, since we have many unmet needs in hepatobiliary surgery, it is even important to share ideas and comments with colleagues in order to improve quite fast our knowledge in this area. So it was really great to talk to you today.
You know, that reminds me of one thing. You probably don't know this, but when we initially formed the journal, we became affiliated very quickly with Women in Surgery Italia, because it's very important to have women involved, particularly in surgical journals, but in particularly with journals that deal with technology. And I asked people for recommendations of people who were doing things in AI and navigation and autonomy, augmented reality, and your name kept coming up many times. So thank you very much for accepting to be one of our editorial board members, and we will definitely set up another one of these episodes down the line so we can catch up. Okay.
Thanks a lot to you.
Great. Good.
Take care.
Break a leg. I don't want to say good luck for your call, so we say break a leg. Okay.
Okay.
Ciao.
Ciao, buona giornata. Bye bye.
Oh, you know what? Hold on one second. I'm gonna